Facial fillers, if not used properly, can have all kinds of effects that are undesirable, and one of them can be looking distorted or even older. Like any other tool, if it's used properly by someone who understands how to get best outcomes, using facial fillers should make you look better, not older. Using too much dermal filler can either distort your face, make it look asymmetric, aesthetically out of balance, and in some cases can even make you look older than you actually are. Dermal fillers are not anti-aging from the standpoint of preventing changes from occurring in our face, but they're wonderful for helping to camouflage changes that have occurred already so that people look younger and more youthful. So they definitely correct some of the signs of aging to make us look more youthful if they're used properly, but they won't prevent those changes from happening. Those are going to be genetically predetermined. My overall approach to facial fillers is a conservative one. First, I like people at a comfortable social or professional distance to just look good, not look a certain age, not have a certain look, just look good. How do you do that? We use fillers in 3 ways. We use fillers to correct volume, or replace volume if there's been loss or change. We use fillers to recontour the face, whether that's cheekbones or jawlines, or forehead or the nose or other areas. And then finally, we can use fillers to fill in fine wrinkles or lines. That's the minority of the work we do is wrinkles or lines. Most of it's contouring and volume. So we use fillers to aesthetically balance the face, balance the upper face and the lower face, make sure everything is harmonious in such a way that it doesn't look like people have had something done, they just look good. There's no absolute minimum age at which you should start getting filler treatments. We do see younger people who are born, for example, with hollow under eyes get filler treatments as early as their 20s. The majority of the treatments that we do in people who've started to see changes over time, or if they look back at photographs when they were younger, they do have some aging changes, tends to be in their 30s and sometimes even a little bit later. Majority of our patients who use fillers on a regular basis are probably between the ages of 30 and 80. In many cases, we can use fillers to keep people looking youthful as really their best option. It's important to do skincare, to use sunblock, to take care of ourselves in terms of what we eat and what we don't eat for that matter and drink, and to use fillers appropriately. For many patients who are in the younger age group, surgery really isn't an option for them. As people start to get older, sometimes fillers can be used in conjunction with surgery, skincare, and injectables like Botox and other neuromodulators for a combination approach. So unfortunately, we do see people really on a regular basis whose experience with fillers has not been the best. Why does that usually happen? Usually it's because someone's expectations weren't met. In other words, they were hoping to get one thing and they got something else that they weren't happy with. Most often, we can fix that. We can either get rid of filler, which was put either in the wrong place or the wrong quantity or the wrong product for whatever we were trying to do, and replace it with something that gives a better result. It's disheartening to people when they've had a treatment and it doesn't go the way they want. But do be reassured that in most cases we really can use fillers successfully, even in someone who's had a bad experience to start with, to get a really nice result.